Just wanted to do that, and then I'll turn it over to Dr. Willis for the COVID-19 update as well.
Thank you, Matthew. Good morning, everyone. Good morning, supervisors. Alvaro, if I could have my slides, please. I'll offer an update on our status overall as a county, and then spend the majority of this presentation talking about our vaccine distribution. You go to the next slide. This is our epidemic curve. This is what we share weekly, the number of cases. Next slide, please. Number of cases each day over time. And this slide will show the three waves that we've been experiencing as a county starting in early March. Next slide, please. And then the peak in July and August, our second surge, and then that third surge, that third wave that we are now emerging out of that peaked on January 10th. We've seen a remarkable decrease in the number of cases since that peak about 1 month ago, and are headed towards the red tier. We are not there yet. The state has placed us in the purple tier again, along with almost every other county. About 99% of the residents of the state of California are in counties in the purple tier. We have some of the lowest case rates of any county, and as counties start emerging into the red tier, as rates decrease, we would be among the first if this trend continues. Next, please. And this shows the state of California as essentially, being a purple state at this point. If we see a decrease over the next few days, we are right now on the cusp of purple and red. I would expect that we would be in the red tier by mid-February, and that will allow further indoor operations, including indoor dining at 25%, increasing indoor retail capacity, and importantly, schools, secondary schools, middle schools, and high schools that have not yet opened would be allowed to open 5 days after we achieve red tier numbers if we stay in the red tier. Next, please. This is our vaccine dashboard. It's available on the website. This will, is updated daily and tracks the number of Marin County residents that have been vaccinated. I like looking at this daily, so just to see how much progress we are making. It's hundreds or thousands, depending on who's vaccinating on any given day in Marin, increases. We are now at 13.2% of our population has been vaccinated with at least one dose. That's about 1 in 8 of our residents. 42,000 vaccines have been administered. And it's important to think about who are those 1 in 8 residents. Right now, it is primarily healthcare workers, people who have been on the front lines, as well as our oldest residents, those who are at highest risk of death if they become infected. Next, please. I wanted to remind everyone of what the allocation for Marin County is and how it's determined, because the lack of supply has been, I think, the most significant limitation in the vaccine distribution strategy nationwide in the state of California and for us in Marin. So all of the vaccine, importantly, all of the vaccine that comes into any jurisdiction in the nation comes from the federal government. There is no opportunity for any independent procurement of vaccine. Either a hospital or a local health department cannot purchase vaccine directly. We are entirely dependent on the supply that comes from the federal government to the state of California. And then the state of California determines where the vaccine is allocated. In Marin, it goes to 2 primary sources. It goes on the left there to Sutter and Kaiser regional offices. That's because Kaiser and Sutter are 2 what we call MCEs, multi-county entities. And then the Kaiser regional offices decide within their networks which counties, which hospitals receive the doses. So our local Kaiser and Sutter are receiving doses from their regional offices who receive it from the state. In parallel, Marin County Public Health receives an allocation directly from the state. And we are able to allocate to our pod, that's our our Marin Center pod that I've shared information about in terms of the number of vaccines we're able to do in that one setting. And then we also allocate to other providers, including Marin Health Hospital. That's because Marin Health Hospital, our third hospital, is not part of a multi-county entity. It's not a Kaiser or a Sutter system hospital. It's an independent hospital for our community. And we allocate, Marin County Public Health allocates doses to Marin Health, as well as some of the other healthcare providers in Marin, including Marin Community Clinics. And then on the right there, you see there's a separate path from the federal government through the CVS Walgreens long-term care program, where that program has been vaccinating in our long-term care facilities, skilled nursing facilities, residential care facilities. And we have been complementing that work with mobile teams from public health to make sure that we're actually accessing and getting those doses into those high-risk settings as quickly as we can. Next, please. And this just summarizes among those players who has been doing the vaccinating so far. Of those 42,000 plus doses administered, 38% have been administered by Marin County Public Health, the majority of those in that one setting at the Marin Center, 21% by Kaiser, Sutter, and Marin Health Hospitals combined, 9% by the CVS and Walgreens federal program, and 31% of our residents that have been vaccinated have been vaccinated outside of the county. Some of them being healthcare providers who work outside of the county and are eligible for vaccine in the place where they work. A lot of healthcare providers who work in San Francisco, for example, were vaccinated in San Francisco. Next, please. And then just as this is the Marin Center in its current life, which is as a mass vaccination site, where we have vaccinated about 16,000 residents, and by the end of this week, we'll be close to 20,000 total residents who have been vaccinated in this one location. Next, please. So what groups are being vaccinated in Marin currently? On the left, our healthcare workers. We're virtually done with the healthcare worker sector in Marin County, and we have been vaccinating persons above age 75. Starting next week, we will move to starting to vaccinate those who are age 65 plus, starting on the 15th of February. Next, please. So why did we decide to move to age 65 plus? One of the key factors is that we have made a lot of progress in vaccinating our 75 plus residents. We estimate by the time that we open to age 65 plus early next week, we will have vaccinated 2/3 of our residents age 75 plus. This is our current numbers. There are 10,000 residents remaining in the age 75 plus age group to be vaccinated, and we have another 26,000 residents in the age 65 to 74 age range who would need to be vaccinated. We have vaccinated 19% of those 65 to 74 and 55% of those 75 plus. Next, please. These are the age-based eligibility across the Bay Area. So San Francisco, San Mateo, Alameda, Contra Costa, Sonoma, Santa Clara are all vaccinating residents age 65 plus. We in Marin County held the line at age 75 plus because for two reasons. One is that we're just looking at the epidemiology of our community, recognizing that we have an older community. And we really wanted to enrich, for those who are most vulnerable, as we've talked about last week, for death, to make sure that they're actually offered that protection preferentially before we open it up to other age groups. As well as the fact that we are in a county that is small enough where we're able to have a singular unified approach working with our hospitals, and we had all agreed to move to 75 plus together. As other jurisdictions moved into lower age groups, it became clear that, and Sutter actually made a corporate decision at the regional level to move to age 65 plus, and there became increasing recognition that because of the progress we had made in the age 75 plus, it was time for us to move forward. And I'll share more about that. Next, please. So why focus on older residents? Why do we choose age-based criteria in the first place? We have a limited supply. We countywide about 10,000 doses per week, and that's between Sutter, Kaiser, and Marin County Public Health, those branches that I described. Older residents have the highest risk for hospitalization and death. It is a simplified criteria. When we're focusing on age, everyone can understand it. We're moving from 75 to 65. We have about 66,000 residents age 65 or older in Marin County total. Next, please. And this is just to the mortality. So why would we focus on age? We've talked about those oldest residents as being much higher risk for death. If you look at the bar charts there, you show about 4% of our residents age 65 to 74 will pass who are infected with COVID-19 in Marin County. So on the right, you'll see our case fatality rate for age 75 plus. About 1 in 7 residents who are infected have died. For age 65 to 74, 1 in 25 residents who have been infected will pass. And then as we move down, the risk of death decreases significantly. For age 50 to 64, 1 in 250 residents. And for residents less than age 49, 1 out of 2,500 deaths. So very few deaths in that age group, given that we've had about 10,000 total cases across the community. Next slide, please. In addition, vaccinating older residents benefits all communities. Equity has been a really important organizer of our effort. And when we look at the percent of residents who have passed from COVID-19 and break it down by age, break it down by race and ethnicity, it virtually mirrors our overall population distribution of race and ethnicity. On the left, you have deaths, proportion of deaths. On the right, you have percent population, and you see that those are essentially the same breakdowns. So all communities benefit equally from an age-based strategy, especially if we are making sure that we're offering vaccines to people in low-income communities, equity communities, as we move into other age cohorts. Next, please. So starting on February 15th, we're expanding to residents age 65 plus. That will include Marin County Public Health, Marin Health, Sutter Novato, Marin Community Clinics. Obviously, we'll continue to reach out to age 75 plus. The Kaiser has scheduled, they were able to predict their dose, so they were able to schedule out appointments through the end of the month. And those appointments were open to age 75 plus, so that will be an important asset for us and contribute to even more completion of that age 75 plus, while other systems move to age 65 plus. Next, please. So how do we remove barriers to vaccination? This has been an important topic for us strategically over the past, since the beginning of our rollout. But as we open up to larger numbers of people, it's going to become increasingly important that we're able to ensure access for those who are most vulnerable. And it's really just thinking broadly, it's really two ways to ensure access. One is to ensure access to vaccination sites like the Marin Center, the pod that I mentioned, where the person travels to the vaccine. And the other way is to have the vaccine travel to the person. So mobile vaccination operations are also an important form of access. Next, please. So we'll first talk about how we ensure access for people when they're traveling to the vaccination site. There's 2 parallel arms there. There's the mass vaccination pods, like the Marin Center, where we're able to do up to 1,500 per day. Those appointments are available to the general public through self-registration online. Majority of the public will use that avenue as having access to the appointments, and there are on-site supports. There's a fast track for people that may not be able to stand for longer or have ambulatory issues, maybe not have full mobility. There are chairs available, there's wheelchairs. There's other ways that we're supporting people who can get to that site to move through that site safely. On the other side, on the right, you see our equity pods. So these are sites where we're actually protecting appointments that are set aside for equity communities with an assisted registration process. With telephonic outreach, we have a phone bank where we're actually able to reach out to individuals in certain categories of vulnerability, including our in-home support service workers and others who have been identified through our medical providers as being higher risk. So healthcare providers, community-based organizations, and telephone outreach offers a tailored experience for those individuals at highest risk to be able to get into appointments with transportation supports. We're working with Whistle Stop, Vivillon, to identify those individuals who may need support and actually moving to those sites for vaccination. Next, please. And then another form of increasing access for people who can travel to a vaccination site is the drive-through pod that we're planning. Drive-through sites are emerging as a best practice for mass vaccination. We had one of the first and most successful drive-through testing sites at the Marin Center. It improves access for residents with limited mobility. We visited a site in Berkeley where there's a drive-through where just observing, there were many people who were, the older resident as a passenger and someone there driving them so that they were able to get them vaccinated without having to get out of the car, without having to walk around. We are finalizing an agreement for a large centrally located point of dispensing as a drive-through that could accommodate up to 1,500 vaccinations per day. So once we have the supply, it would really function in parallel to that other large mass vaccination site we have at the Marin Center. Again, depending on when we have doses, easy access to this particular site through public transportation with the go live date as early as February 21st. Next, please. And then finally, outreach through mobile vaccination teams. So this is bringing the vaccine to people, to residents where they are. We have 2 teams under Marin County Public Health. They have visited skilled nursing facilities, residential care facilities, as I mentioned, to complement the CVS Walgreens effort. They've been in assisted living facilities, now moving to low-income senior housing, and then moving into equity communities with higher prevalence. So looking at those communities that have the highest prevalence of COVID-19, as well as low income, those HPI census tracts, we've talked about this before, that our county is divided into 4 quartiles in terms of low HPI, that's Healthy Places Index. That's when we talk about our equity metric. We're always talking about the percent positivity in those lowest income, low HPI quartiles. Those are the same communities that we will do proactive outreach in terms of bringing the vaccination to them through mobile operations. That mobile county, the public health mobile team has performed 2,430 vaccinations thus far, primarily focusing on our facilities and now moving into senior housing, low-income senior housing, and planning to move into communities with high prevalence as we move forward. We've also contracted with Curative. Curative is shifting from testing support. They have mobile testing. It's been one of the great assets for us in terms of actually getting testing to different communities, especially out in West Marin, for example, rural communities. Curative's now shifting operations to offering vaccinations. Marin County Public Health would be offering Curative the vaccines themselves. They have no independent procurement, but it's an important asset for us. So Curative will be a parallel mobile operation for us. Next, please. So in summary, our case rates continue to decline. Red tier status potentially by mid-February, as long as everyone does everything they can to prevent that 4th wave with physical distancing, covering our faces, avoiding indoor social gatherings, not being falsely reassured that we are moving forward with vaccination. It's going to take a long time before the vaccine is actually able to really meaningfully offer us immunity at the community level. Our vaccinations operations are in place. We have, robust operations in multiple locations who are really just teed up and ready and waiting for more vaccine to get to everyone who we think is important to vaccinate. And that's all of us ultimately over time. Supplies remain the limiting factor. We're focusing on the highest risk populations. We're moving to age 65 plus next week. And 1 in 8 Marin residents has been vaccinated so far. And again, it's all up to us, something we all have control over right now. Amidst all that we don't have control over with regarding the vaccine rollout from this federal to the state to the local level, something we do have control over is our own behaviors to prevent surges in cases. And that concludes my presentation.
Thank you, Dr. Willis.